If you suffer from hair loss but you're afraid to get a hair transplant done, if you know that you're balding but you have certain questions on your mind, how will it look when I undergo hair transplant? How will my thinning balding area look after it gets hair in it? Will it thin out more or will it be better? What will be the condition in my donor area? Will the hair look normal or there will be a lot of sparsity in it? Then what will be the life of my new hair on the scalp? In a nutshell, will my hair transplant be successful? Will I be able to achieve what I want to achieve after this session of hair transplant? If you have these many questions in your mind, this video is for you. Today we will answer all your questions one by one. Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon. We are going to discuss this today. So if you want to know more about hair problems, subscribe to my channel. Starting with first reason why you can have a failed hair transplant. See, we should all know the cause why you are having a hair loss. The diagnosis of your hair loss should be very clear. In maximum cases, the diagnosis is male pattern hair loss or female pattern hair loss, and hair transplant is the treatment for both of them. Then there are other things for which hair transplant is the treatment of choice. Like if you have a burn scar, if you have undergone any accident or trauma and then you have lost your hair scalp hair, or if you have a triangular alopecia on both sides or one side, or if you have a turban alopecia or traction alopecia. These are a few examples how the treatment of choice can be hair transplant. Then there are other reasons for hair fall. The diagnosis if is fibrosing alopecia. Like if the tissue on the root of the hair is replaced by fibrous tissue, there is no normal tissue there. Then even if you undergo hair transplant by taking roots from the back, harvesting from the back and then putting on the front in the recipient area, and your disease is active, it is going to destroy those roots also. So in cases of fibrosing, active fibrosing alopecias, treatment of choice is never hair transplant. If your disease is quiescent for at least 2 years and this is decided by your doctor with you at the time of consultation, then your doctor will give you an informed choice that now you can opt for hair transplant, but you should be cautious that you can lose these hairs if your disease becomes active again. Then there is a problem called alopecia areata, in which you get point-shaped areas in the beginning and later they may expand to coalesce and you can have the hair loss from a large area, or sometimes it may regress on its own also because it's an autoimmune problem. Your body becomes enemy of your own hair follicles. It starts taking them off. It starts making them dead, but there is no fibrosis. The follicle is still there, but it is not growing anymore. There are a lot of lymphocytes when you see in the histology. So not going in that depth, let us now understand that this alopecia areata, if it is active, you are not a candidate for hair transplantation. Now, how to find out? The most important thing is trichoscopy. Trichoscopy, when done properly, gives us a fair idea of the problem which you have so that your diagnosis is made correctly. But as always, when in doubt, biopsy it out. So a biopsy is a gold standard in diagnosing the causes of alopecia. Now, I must tell you here that sometimes normal diagnosis which has hair transplant as its treatment coexists with abnormal things in which hair transplant is not a treatment. So now we know that there are cases, there are patients who come to us in a normal OPD. We do the consultation, we do the trichoscopy, we find out areas where AGA is there, androgenetic alopecia is there, for which hair transplant is the treatment of choice, but at the same time we get symptoms and signs of androgenetic alopecia along with alopecia areata too. So there may be two areas where one disease is active and the other disease is active at the other area. So we have to be cautious about that. Also, sometimes after we do the hair transplant, we find out that the result is not so great because of certain these kind of reasons. So we have to find out and we have to be cautious about it. You may press the like icon if you are liking this video till now. Second reason for how hair transplant can fail is if we take the grafts from unsafe donor area. So at the back of the head, you have a safe donor area and the area lying above or below it is unsafe. Why is it so? Because in the safe donor area, the roots of the hair, they do not have DHT receptors, and even if they have, they will just, become a little thinned out in later stages of life. But these receptors, they do not have proper DHT receptors, and also when we put them here in the recipient site, they grow well. If we take the roots from unsafe donor area, they have the DHT receptors, and even if you have done the full scalp from taking by FUE, then these hairs are bound to go by the influence of DHT. Now, how do we find out? Again, trichoscopy comes to rescue. Then the second way is if you shave and you see in 5, 6, 7, 8, 10 days, you will find the safe donor area very nicely growing, and the rest of the area will not be that nicely growing. And also by visual inspection, sometimes we are able to find out. If you have any comments or any question at this point of video, you can always write in the comment section below. We'll be happy to help. Reason 3 of why my hair transplant looks like it's a failed transplant. Suppose I underwent hair transplant and I get good hair. Later on, when I see my hair is thinning out. So sometimes what happens at the time of hair transplant, you have some existing hairs also, which we take care very nicely not to damage them when we transplant your hairs. But if after hair transplant, you get good growth and then you stop your medication, you do not take medical treatment for the existing hairs, these hairs then fall off because these are the hairs which have DHT receptors. So when they fall off, you feel my transplant is bad, it is a failed transplant, I lost my hairs. But actually, these are the hairs which were existing hairs which we protected at the time of transplant and which are not there anymore because we have stopped taking medical treatment. If you want to get a hair transplant done or you are a hair fall patient, you can always call us for consultation on the numbers given below. Reason 4 of failed hair transplant can be while we were collecting the grafts, we did not take care of keeping them wet. Graft desiccation or drying is the number 1 killer of grafts. So what will happen? While we are doing the procedure, suppose somebody did not take care to wet the grafts, they got dried. Usually we have the fan or AC running, there is air circulation in the OT. Then this dryness will lead to damage, ischemia of grafts. The grafts will no more survive after we put them in the recipient site. Mind you, it will not show while putting the grafts. After, suddenly somebody felt, the grafts are not wet, let us put some normal saline on it. So it won't come back. The damage has already been done. So we have to be very, very cautious of not drying the grafts. This is very important for the OT people. This I'm telling you because it can be the killer of grafts. Next reason can be if the technicians are touching the graft from the bulb or the root where the germ cells are. If you touch them, they are crushed, the graft is already no more. It will be there physically. The shaft will be there, the root will be there, but the germ cells are crushed. So there is a particular way of handling the grafts. It is called no touch technique. It is called touching by the fat below the graft. So these are small intricacies which are taught as a skill to people working in the OT so that the grafts are unharmed. They are not dried. They are wet, chubby, nice, living, because it's a living tissue which has to be transplanted on the recipient side and it has to grow well. If you want to find out the 5 commonest mistakes which a person can do before opting for hair transplant, click on the iCard above. The 7th reason of a failed transplant, which means the hair was put, everything was done, but the hair did not grow. The 7th reason can be there was a mismatch between the depth of the slit created and the length of the graft. Also, the point where the graft was touched could be faulty, it could crush the grafts. And also the number of attempts in which OT staff is putting the graft. So you need to have very skilled people in the OT which always know what to do, how to do, and they do it perfectly. So in this way, the OT team experience and their skill matters a lot. We at Saraswat Hospital, we have a team which has been with us for more than a decade and they know which part is to be done how. Also the doctors from where you are getting your hair transplant done, they should be highly qualified, skilled in their job. You should see the credentials of your doctors. They should be ABHRS, American Board of Hair Restoration Surgery diplomates. They should have the membership of different national and international organizations like ISHRS, which is International Society of Hair Restoration Surgery, and so on. So normally we do a hair transplant only after seeing that you have no metabolic problem, your blood pressure, diabetes, everything is either not there or it is under control. But it may happen that after we do the hair transplant, you may undergo some surgery or your BP may shoot up or there is someone having improper glucose control, the diabetes is not under control, thyroid is not under control. In short, but there may be other hormonal and nutritional imbalances, stress factors. All this can lead to improper hair growth post hair transplant. So if this happens, or you have alcoholism disorder, or you have tobacco chewing problem, or some other drug which is a drug of abuse, then these are the metabolic problems which can hamper growth of hair. So healthy body leads to better hair growth. This is always the statement. Do share and subscribe this video to your loved ones if you feel there is value in this. And before you undergo hair transplant, just take care of all these factors and get this fear out of you that hair transplant can be unsuccessful. If everything is taken care of, things are checklisted, they are sorted out, then you should have a very good hair growth after your hair transplant. If you want to know more about the cost of hair transplant, the factors on which it depends, and how it is decided, click on the video on the left.